Here's a bold statement. Generic-only policies in private healthcare are quietly eroding patient rights and doctor autonomy. And it's a problem that's only getting worse. But here's where it gets controversial. While cost-cutting measures like these might seem practical, they could be putting patients at risk and undermining the very foundation of medical ethics. Let's dive into why this matters and what's at stake. The Malaysian Medical Association, MMA, has sounded the alarm on a troubling trend. Third-party administrators, TPAs, imposing blanket generic-only mandates on private healthcare providers. These policies, which restrict prescriptions to generic medicines, are not just a bureaucratic nuisance. They're a direct threat to patient care and a doctor's ability to make informed decisions. And this is the part most people miss. It's not just about saving money. It's about who gets to decide what's best for the patient, the doctor or the corporate payer. MMA President Dr. R. Arasu puts it bluntly. Formularies may guide, but they must never dictate care. Patients have the right to informed choices, and while generics are often suitable, there are critical exceptions. For instance, narrow therapeutic index medicines or cases of intolerance require specific brands for safety and effectiveness. Doctors, not TPAs, should be the ones making these calls. Any substitution must be transparent and agreed upon by the patient, a principle that's being increasingly ignored. Take, for example, a recent directive from a TPA representing a bank. Panel clinics, hospitals and pharmacies were ordered to limit employees to generic versions of long-term medications, with prescriptions listing only the active ingredient. The MMA argues this shifts control from doctors to corporate payers, opening the door for procurement-driven decisions. Commercial interests, warns the MMA, will slowly but surely override clinical judgment, compromising patient care. Here's the kicker. The real cost drivers for non-communicable diseases, NCDs, like diabetes, heart disease and cancer, which cost Malaysia nearly 10 billion rands annually, aren't medicine prices. It's complications from poor lifestyle management and late detection. True solutions, says Dr. Arasu, must focus on prevention and behavior change, not procurement savings. The NMA has been warning the government about this since 1998, calling the lack of regulation of TPAs shocking and inexcusable. Meanwhile, the Ministry of Health, MOH, lacks the legal authority to mandate generic-only policies for private hospitals under Act 586, which only regulates facility standards. The MOH's own generic first policy applies solely to government-funded healthcare facilities, not private ones. So where do we go from here? The MMA's stance is clear. Generics should be the first option, but never the only option. Doctors must retain their professional judgment, and patients must remain fully informed and empowered. The Association of Private Hospitals Malaysia, APHM, echoes this concern, warning that blanket generic-only policies risk compromising patient care. But here's a thought-provoking question. Are we prioritizing corporate profits over patient well-being? And if so, what does that say about the future of healthcare? Let's start the conversation. Do you think generic-only policies are a necessary evil or a dangerous precedent? Share your thoughts in the comments below.